In this module, we're talking about how to get ready for your clinicals because, as you know, nursing school or your NP school or even your CNA school has two parts: the theory part, lectures, and then you also have clinicals. So, welcome to nursing. So, as a first time learner, you have to get ready for clinicals. Get your mind set that you will have clinicals once a week. That's what I had, once a week after learning in lectures. So you will have lectures, you will learn about fundamentals as a beginner, med-surg fundamentals, and then you will have practicum. So you will practice in your open lab. You will go there with friends and your instructors, and there are so many amazing people that will be helping you out. So you will learn how to care for a patient, how to do a head-to-toe assessment, how to take vital signs. Hey, hey, such a baby nurse, baby student, you're learning how to take vital signs, how to say hello to your patient, introduce yourself to your patient, and all this good stuff. So you learn at school. And then you will have one assigned clinical instructor that will be taking you guys to clinical. So you will, on the first day, you will have your schedule, you will have your assignment, you will know which hospital you'll be going, and then you will have a list of things that you have to do, such as vaccinations, your background check, your fingerprinting, and also you have to have a doctor examination that just show that you are in good shape to take care of patients. But apart from that, in your bag, what do you take for clinical? Number one thing that's going to be your best friend is your stethoscope, okay? I still have my Prestige medical stethoscope from nursing school. This is very emotional, which I always have with me. So you will need a stethoscope. You will need a pen light. You have to have a backpack that's gonna help you because the books are heavy. So backpack, stethoscope, pen light. You need a watch that you can count your patient respirations. Okay. You're gonna need a clipboard to write down your information when you do the assessment and when you take all the vitals and get all your patient information. You're going to need a clipboard, and of course you're going to need pens, different color of pens so you can highlight the most important things for you for later on for your care plan. And don't forget your compression stockings. Um, you will need scrubs. So your school will provide the color scrubs that you need, and you will also need comfortable shoes for clinicals. So that's pretty much a big picture of your clinical rotations. And then once you get to your clinical facility, always make sure you are 15 minutes early. Always 15 minutes early, meaning 30 minutes to the parking lot, and then the time for you to find parking, to walk from the parking lot to your point of meeting, you have to have 15 minutes once you get there. You have to be on time, eat something, have your protein bars, always have a snack because it's 12 hours, it's new for you, it's going to be long, it's a lot of information that you have to learn and digest. So, give yourself time, rest to get there. Okay. Once you get there, you will meet with your clinical instructor that usually comes at 5 p.m. The time to choose the patients based on what you've been studying in school, and she will assign you the nurses and the patient, and that's how your day will start. Do not hesitate to ask questions. There's no dumb questions. There are no stupid questions. You are here to learn. You want to learn and absorb as much information so that when you're done with nursing school, you can be the best nurse that you are meant to be. Okay? Make sure you get exposed to everything that's happening. Make sure you ask questions, and make sure you are just friendly with everybody: the CNAs, the nurses, the transportation team. Everyone is part of the team. Physical therapy, occupational therapy. So your patients, your family patient members, your doctors, secretary, everybody is part of a big team. So make sure you're friendly, and the clinicals will be fantastic. So here are things that you're not supposed to be doing on clinicals. These are the mistakes that some students will make, and they don't know that that will cost them the grade in clinicals. Okay, if you're not participating in skills training, if you're not reading your charts properly, you have to read your charts, know why patient is here, what is being done, what's the plan of care, what medicine they're taking, and what is the plan for them. You have to read thoroughly your charts. Okay, and also not being proactive, staying quiet. I know I was an introvert when I was in nursing school just because everything was so new for me. You have to participate, you have to say something. You will have debriefs, you will have one-on-one with your clinical instructors, you will have one-on-one with the nurse that you are assigned to. You have to be able to ask questions, say something. Why is the patient getting this? Why is the patient here? Why? What's the plan of care? Ask questions, okay? And if you're not receptive to feedback, that's a bad sign. So you have to stay away of these mistakes because they can cost you your clinical grade, and you don't want that to happen. Two more things that you need to have during your clinical rotations are great communication skills. Okay, you always have to use the SBAR. All right, uh, background situation, background, assessment, and recommendation. So that's your SBAR: situation, background, assessment, and recommendation. Very important. That's how you communicate with the team. And also you have to have eye contact. Culturally, sometimes you don't look at people in the eyes, but it's very important in this case scenario to have eye contact with everybody, including your patient. And finally, you have to be able to give a great bedside shift report. You have to, because that's what gives the picture to the upcoming nursing or nurse or anybody else about your patient. So I'll walk you through how to give an amazing bedside shift report.